Now, self-care is an approach that is being encouraged in some countries among rural communities as an approach to ensure women are safe and healthy before, during, and after pregnancy. Joining us in the studio for more is Betsy McCallon, CEO of the White Ribbon Alliance. It is an organization dedicated to ensuring that all women to be safe and healthy before, during, and after childbirth. Betsy, welcome to the show.
Thank you, Linord. Thanks for having me.
It's a pleasure to have you. Listen, before we talk about the self-care approach, which I introduced earlier, what are you seeing in terms of recent trends and progress around maternal and newborn health?
Well, I think, as you said, we are seeing progress, which is the good news. Over the last decade or so, maternal deaths have been reduced by almost half, which is fantastic. But what we're also seeing is that we now need to make some other changes to meet the needs of all women, particularly the poorest women, the most marginalized women in rural communities, women with disabilities, women living with HIV, refugee women, if we're really going to achieve the goals for reducing maternal mortality globally. We've recognized that a lot more women now have had access to services, which is great. But it's the quality of those services that remains incredibly poor in many countries. We've also seen the issues of involving people themselves directly in their own health care is really what's going to drive the difference.
And this is really thinking about innovative ways to really scale up on the gains that have been made. So self-care is being encouraged. Tell us more about this approach.
Yeah, so self-care is simply actions that individuals, families, and communities can take for their own health care. And in the context of maternal health, that means really having the knowledge about what you need to do during your pregnancy to take care of yourself, how to plan for your birth, and particularly in really remote communities, that's a major action. The main killers of women are the delays in them knowing about danger signs during their pregnancies, delays in then getting to skilled care. In some of the communities where we've started self-care programs, I mean, they're incredibly remote. In Bangladesh, for example, we're working in an area ridden by natural disasters and floods where women are sometimes giving birth on levees. Wow. So having that information and that knowledge, getting families and communities involved so everybody is taking responsibility and really supporting women during their pregnancy and their childbirth, as well as how to care for their newborn, is making a huge difference. And
so you say it's making a huge difference. What type of impact? Can you give us an example?
Well, one of the main impacts that we've seen is that it actually, by having the knowledge and the confidence and the information, women are now seeking care. So in Zimbabwe, we're working in a rural area called Kwekwe. The utilization of health services at some of the facilities in very short number of months has dramatically increased. And what we're hearing from healthcare providers there is this is faster progress than they'd seen in decades because people have the information and they see that while they are now going to the facilities, that there's also a responsiveness on the part of providers and the government to provide respectful care to the women.
And International Self-Care Day just passed. Yes. I understand the White Ribbon Alliance was in Nepal, and there is a campaign ongoing right now. Can you tell us more about it?
Yes, so International Self-Care Day is July 24th, so 7/24, because self-care is something that we can practice every day. And in Nepal, we celebrated that with members of the White Ribbon Alliance from around the world, kicked off with an event with the Prime Minister of Nepal and the Secretary of the Ministry of Health. They've launched a self-care campaign not only focused on maternal and newborn health, but on health in general, really encouraging people for preventative care about, again, nutrition, exercise, abstaining from tobacco and alcohol. And they're seeing this as critical, a real partnership between people and government to improve the health and to focus on well-being of their citizens as well.
And speaking of citizens, citizen accountability and citizen engagement is something that your organization encourages. Tell us more about.
Yeah, we've found that really is the biggest thing to make the difference. The people who are most affected have the most at stake. They're the ones that know what the real problems are in their communities. They know what the solutions are. And sometimes there are issues of, lack of investment, lack of healthcare providers. But there's also issues that can be solved by just making things work better, by looking at what are the bottlenecks, why are things not working, and citizens in their own communities are best placed to do that. We do that through things like citizens' hearings, of bringing citizens together with elected officials, with the media, with healthcare providers to look at those challenges and identify solutions. We use things like checklists of having citizens go into health facilities and look at what is supposed to be in place and what's actually in place. And through that, we've seen really rapid, again, improvements in service delivery, which then means more women actually going and getting the services that they need.
That's great. Well, thank you so much. And more, all the encouragement in your work on the ground. Thank you so much for joining us.
Thanks.
And that was Betsy McCallon. She's CEO of the White Ribbon Alliance.